everyone, this is Dr. Pujal from Baby Bloom IVF and Maternity Clinic, Gurgaon and Rohtak. In series of videos, we have discussed very important topics regarding IVF, high-risk pregnancy and hysteroscopy, laparoscopy, etc. Today we are going to talk about a very important topic, fresh transfer versus frozen embryo transfer. Many patients ask me that which of the transfers are better. But before I answer this question, let us understand what is a fresh transfer for the patients who don't know the procedure of IVF. Fresh embryo transfer is when we do the embryo transfer in the same cycle, when we actually stimulate the patient or the woman. IVF starts on the second day of woman's period, and those injections may continue anywhere from 10 to 15 days. The process of IVF starts from the second day of periods of a woman. The injections are given for 10 to 15 days. After the egg retrieval or the process of taking out the eggs, mature eggs from the woman's body, the process of fertilization is done and the embryos are grown anywhere from 3 to 5 days. After the embryos are made, if the transfer or the embryo is placed inside the woman's body in the same cycle when the injections were given for development of the egg, then it is called as fresh embryo transfer. If these embryos are frozen or stored, or in medical language it is called as vitrified, and the embryos are put into the woman's uterus in the next cycle or after a few months, then it is called as frozen embryo transfer. Now let's come to the topic, what is better? Is fresh embryo transfer better or a frozen embryo transfer better? Well, this is a very situational thing, but in general, frozen embryo transfer is something which is not preferred today, because in a cycle where we actually stimulate the lady with injections so as to get multiple number of eggs, in the same cycle, if we do the transfer, we must understand that the woman is under the influence of supraphysiological levels of hormones which affect the endometrium, that is the lining of the uterus, which actually has to accept the embryo. The other thing which can happen and is a very dreaded complication, which is known as OHSS, ovarian hyperstimulation syndrome. That is when the ovaries swell up and there is fluid in the abdomen, and it can actually lead to very bad complications. To avoid these two situations, number one, rejection of the embryo because the woman is under influence of so many injections, and number two, a condition which I just said, OHSS, we generally avoid giving a fresh embryo transfer. A frozen embryo transfer is a very programmed thing. A frozen embryo transfer is when we actually freeze the embryos or store the embryos or vitrify the embryos. This process of freezing the embryo is called as vitrification. In this, the embryos are stored in a temperature of minus 196 degrees in liquid nitrogen. Many patients ask me, what is better, fresh embryo transfer or frozen embryo transfer, or does frozen embryo transfer have any effect on the baby, or the procedure of vitrification, does it have any effect on the baby? We must understand that frozen embryo transfer is done for the benefit of the mother as well as the embryo. When the woman, after a gap of 2-3 months, comes back for an embryo transfer, she is generally out of the effects of those injections that she took, and the endometrium is more receptive and the ovaries have come back to their normal state, and the pregnancy is much more risk-free. I would like to stress that frozen embryo transfer is the transfer of choice today because it has much more results and puts a woman into a much more comfortable state, and also the results are much better. I would like to stress upon again that freezing does not have any effect on the baby born out of frozen embryos. The woman is much more comfortable during the transfer, and also the dreaded complications of OHSS is also avoided. Plus, of course, for what we are doing the IVF is success. The success rates are also higher. So I hope this information was helpful to you. Do not shy away from getting your embryos frozen. You can even plan your second baby through your frozen embryos. Here at Baby Bloom IVF and Maternity Clinic, we generally do frozen embryo transfers for all the patients and try to give them maximum results. We have branches in Gurgaon as well as Rohtak. You are free to contact us in case of any doubt or an opinion. Thank you very much.